We do have several disorders that are associated with the eye. And so starting at the top, that first one there is called blepharitis. There's itis again. Remember, we know itis is inflammation. This is going to be inflammation of the eyelid. This is something that is chronic. It's chronic inflammation of the eyelid edges. And remember, the term chronic means that it's something that occurs over a period of time. The next one down is ptosis. That P is silent. And ptosis is for a droopy upper eyelid. You can see here, it's almost similar to a lazy eye. It has some of the same characteristics, but we call it ptosis is the clinical term. Conjunctivitis, also going to be familiar, otherwise known as pink eye for obvious reasons here. The eye turns pink. It also has a discharge associated with it as well as inflammation. And then at the bottom, this is a stye. A stye is an infection that actually lies down at the border of the eyelash. And it says, apply moist, warm compresses, but do not pop. This isn't similar to a pimple, so you don't want to pop this because it would make the eye more susceptible to infection. So warm compresses over time, applying small amounts of pressure, would allow the stye to actually dissipate over days. Cataracts and glaucoma, also going to be common disorders. These are disorders of the internal eye structure. And with cataract is what you see in the photograph here. It causes a cloudy covering to the lens of the eye. It's almost a grayish cover that lays over the top. Over time, cataracts can become thicker and thicker and can definitely impede one's vision. Glaucoma is the next one down. Glaucoma is caused by increased fluid pressure. There is a tonometer that can diagnose this. The ophthalmologist has the ability to be able to measure the amount of pressure that's behind the eye. And the pressure, as you can see here in this diagram, is what causes glaucoma. Also can impede on vision over time. Retinal detachment. Retinal detachment causes floaters and light flashes. And usually you can do this if you close your eyes for a long period of time, nice and tight, you may see those floaters and light flashes. Over a period of time, that can cause retinal detachment. And you can see here in the picture, this is a normal eye, and this is an eye with retinopathy. Retinopathy, also very similar to retinal detachment, is caused typically by diabetes. And this is a damage to blood vessels that supply the retina. So again, going to cause those floaters, white floaters you may see in your vision, or light flashes. At the bottom there, you have macular degeneration. And macular degeneration is a dark spot in the center of the field of vision. Now that dark spot, because it's right in the center of the eyes, it does not affect the peripheral or the side vision, only what the patient sees head on. Here in the diagram, you can see the healthy eye versus an eye that has the macular degeneration. So here in this slide, we have two terms. We have strabismus, and then we have amblyopia, which is lazy eye. Both are similar in their diagnosis and the behavior. Here with the misaligned eyes, you can see that the eyes tend to cross. With the lazy eye, you have one eye that's working harder than the other. Generally, they're both because of the muscles of the eye. And so they can be treated the same way, usually with a patch. If we apply a patch to the eye that is the stronger eye, then that's going to make the weaker eye have to develop the muscles to be able to align or not be a lazy eye. So treatment is the same. Notice for strabismus, misaligned or unbalanced muscles. However, for adults, it could be problems with the nerves of the eye and or muscles. Whereas the lazy eye occurs as a misaligned eye becomes lazy. So this is an untreated misaligned eye. And again, the patch is placed over the fully working eye to force the individual to use the eye that has the weaker muscles. Now here we have refractive disorders, and you can see in the picture the change in the eye. Myopia, hyperopia, presbyopia, as well as astigmatism. Myopia is going to be the clinical term for nearsighted. Now, when someone is nearsighted, that means that they can't see things at a distance. Hyperopia is going to be the opposite. So hyperopia applies to individuals that are farsighted. Now, someone that's diagnosed as farsighted cannot see things up close. Presbyopia has a prefix of presby. Presby is in relationship to aging. So presbyopia is going to be a loss of vision due to aging. And then our last term there is called astigmatism. Astigmatism is an uneven cornea that causes blurry vision, and astigmatism tends to take things that are seen in a circular form typically, and it makes it more into an oval.